Regardless of Kenya having one of the best EMS or emergency medical services provision in Africa, only a third of Kenyans access this service. And because of that, many Kenyans lose their lives while they are being taken to hospital. Good evening and welcome to Health Watch. I'm your host Karen Cheriot, and today we seek to understand why Kenyans do not use the EMS or emergency medical service provision.
Komute hospitali ndago shida nebo accident kegure ndako ambulance bo wasingishu makitinye lakini mimi ketindoi amma tinye shughuli amwa baishane boda boda uchumi chebo ngweny makimuchi beitab ambulance mangen anyun amwa kiboishaje kibaje biikab ngweny keboishe chebo ngweny amu milekit pikipikit lekit taxi keboishe kunoto.
Hiyo namba mimi sina, na nikaona kweli Kenya yetu tunaendelea, kwa sababu kama sisi tumefikiwa kuulizwa neno kama hilo, tuko hatua kwa hatua bali sana. Kwa hivyo kwa sababu leo niko na furaha, maana nitajua namba ya ambulance ili ya kwamba kitu yoyote ikitokea sitahangaika, nitapiga namba ya ambulance ya area ya kwangu na nitapata usaidizi. Hapo mbeleni sikukuwa na namba hiyo na sikujua ya kwamba hiyo ni jukumu yangu ya kuwa na namba ya ambulance.
Huko ni tabu, huko hakuna ambulance pale tuko huko. Hakuna namba yote ya ambulance kaunti wametupatia.
Haujafikiria kuwa na namba ambulance?
Sasa tukiwa naye na penye naishi barabara ni shida. Okay, hata nikiita hiyo ambulance inategemea ni wapi imekuja. Jumali naishi Kapseret, St. George's. Huko hakuna barabara. Barabara ni mawe tu. Hawajakuja kutengeneza. So hata ambulance hizi tusaidia tukiwa na emergency. So mahali kuna shida ni kwa referral pande ya emergency. Emergency inafaa watu wanashughulikiwa kabla mtu jalipishwa malipo yote. Lakini unapata habari referral ukienda emergency wanakulipisha risiti, sijui fungua file, mgonjwa anagonjeka hapo, hawashughuliki. Hiyo ndio yenye shida ya wasingishu, bado referral main wako na hiyo shida. Pia wagonjwa wanakaa kwa laini muda mrefu. Unapata mtu anakaa 6 hours lab. Mtu mpaka ana surrender kutibiwa hapa, anaenda kutibiwa private. So referral bado kuna hiyo shida hiyo. Nafaa serikali isaidie sana pande ya matibabu ya referral.
Sijui. Because nambari ya ambulance hizi kudanganya najua yote. Because si tuna gesingi tu ile inapita kwa barabara, then kama iko na mtu tunamsimamisha, then anatupatia beshte yake. Then akishatupea beshte yake, then tunampigia simu. Si emergency kitokea, si unajua tu sio mimi ndapiga simu, ni wenyewe watakuwa na simu yangu ndo watapiga simu. Because sisi wenyewe tukisema tujisaidia ni ngori. Ambulance iko na kila kitu, before mtoto afike hospitali atakuwa shapona. Na si unajua tukichukua mtoto kumpeleka hospitali atakuwa anaumia zaidi. Kufika pale anaweza kuwa na majeraha ama afariki. Maana ambulance inasaidia sana na ni vizuri tena tuko na namba ambulance.
Dosi tinda namba ya ambulance?
Samwatinye.
Kama yeye anajali
Kimi kityo mami kinekyoe.
According to KMPDU, many medical emergencies in Kenya result from road accidents, blunts, and burns. However, because of lack of adequate EMS resources and emergency response training for medical personnel, access to emergency care needs to be improved and available to everyone, including those in hardship areas. With that in mind, what qualifies as an emergency?
Emergency ko rongo kile emergency ko kile ngumaje njokinet. It means the life of somebody is at stake. Muje kosita chita kutumagia tende naraka. Emergency can come in many ways. Muje ko emergency because of accidents, maybe road traffic accident, maybe go sija ajali ya barabara, motorbike anagogari accidents cheboga ibunche kawirge chita in height, maybe a roof obutingwen anakabut from a height koita or mara cliff kobutingwe. Those are accidents which requires emergency attention. Nagombi kora emergencies cheu mara home accidents. Kaput chita in bathroom and go maybe la kwen galogoi tongulota kagarage in the throat. All those are emergencies. Ikeba emergencies go irrespective of EME, go the first thing go get access and healthcare attention. Nemagat at that time, ke saving a life. It may be majachita oxygen, and it may be majachita ICU, and maybe major urgent surgery can relieve the problem. All those go, you have no time to think of anything else. Majachita araka can saving that life, because life is, there's nothing you cannot compare with life. So at that point, you cannot talk about money. It's life. And that's why in the Constitution, everybody has a right to emergency care, irrespective of EME and UGAWE.
Emergency services don't just boil down to medical services alone, as Dr. Koech explains.
If the Soman Constitution, if people who are educated and Kizaman Constitution, commit to Kemagat. One, go access go in your authority. Me number is General Chitul Gonai, Amun, Maina, Makinige, Taratet, Mojago Girwe, Skogarak, Taget, Kogarak Mebuse. So, ambulance service. Kumi nambari sekche nyolo ingen chepa ambulance service. In each county, kumi nambari sekche igisatan aside chepa ambulance. Anago police 999 will get attention because the village police could maybe go directed to the next ambulance service. But generally, everybody chitu last month can I number of ambulance. Humanly, you'll be okay always. Agitaga emergency kit. Yeah, it's a must. Emergency kits. But even in homes, it's a requirement in there at least some emergency kit. In terms of emergency, if Maraget well, at least you need something to stop the bleeding, a bandage or something. So emergency kit requirement, and it's important for everyone to do either access to numbers and kits.
In order for emergency services to be effective, there must be laws that uphold the service provision.
Our experience, even in our own ambulance, maybe imagine an ambulance wider. So the ambulance could be alright, it's not a joke. Of course, maybe in a driver's ambulance, on the lights or mamutichi. So that's wrong. Like in the kawaida could be a patient ambulance in the lights. It's a requirement by law. He got your way. Yeah. So all drivers, it could be your relative, Negimuti, Nemi ambulance, and auto, number to Raka. Cotiger, Kumemach, Cotta stack, Parabara, quite like you're killing gay marchita because Marago might go much at. So Kawaida, Niger ambulance, please keep way because it's important. It's somebody's life is at stake. And it could be anyone. It could be your relative. It could be anyone. In other countries, Israel, there's a requirement by law, care drills, because Magaina ile bitu earthquake and a bitu disasters, Sorry. In Kenya, there be such a thing in law, but for hospitals, like ours here, we always try drills every 6 months. A drill will show your preparedness to accidents. Yeah, so a drill is just a simulation, never a real accident, but it's just a simulation. It's a drill, and so we test our workers, our staff, our doctors, our equipment, our resources. Computer accident, maybe a mass accident. A mass accident is where several people have had an accident. But computer 20 here at that point. And in terms of, let's say, fire, which along where people get burned, what happens? So all those are critical, and we try, as we do it every 3 months, just to make sure we meet everything. We have everything on board. Get a check, emergency dray, be prepared, so that we know they can be saved. Fortunately, most county governments have made efforts concerning ambulances. Almost all, Nitu, Bomet, Kericho, Kakamega, almost everyone got the ambulances. Those ambulances, they have helped because of transfer and ambulance, and they have helped in a way. And because I'm a big those facilities, because at the end of the day, in terms of safety, from one station, hospital, to another hospital, and more better facilities.
Do you have an emergency number? Other than private hospitals having emergency numbers, counties have also been able to provide them through county referral hospitals.
Our emergency line always is 0782121214. If you ring that line, you get emergency attention. And even the ambulance service got the same number, so that because the emergency ambulance Araka, any time of the night, 24 hours, because accidents come in any time. And we have staff ready always to transport patients day and night. 0782121214. At the moment, counties have had problems with allocations from the central government and may be not able to support facilities come ambulances. But before, so long as somebody is coming in the county, I go much ambulance. Go, for example, Narok. Narok have been bringing patients free of charge. Others come something to go transported. So it depends on which county. Depends on the resources allocated. I think the management of the county health service. Largely, we deal with emergencies. So people come odd hours of the night. Maraga put an accident, kayemetit, and I got bleeding in the brain. All those things, they come in throughout the night. So we do. The number of cases varies. Sometimes we do 10 cases in a day, sometimes 2. So it varies per day. But we try to do it quickly, because unfortunately for our brain and spine, time is of essence. Because they lose even 1 hour, immediately. Outcome immediately after 2 hours. So time is of essence, and we try here to make sure improve. And so we do continuously. We rest. We have teams. Here we have a lot of support, and so we get time to rest. Others continue. So we work in teams. So I could be here today, tomorrow I'm resting or I'm doing other work, maybe teaching. Yeah, so we are here.
With that in mind, we worked at Top Hill Hospital to understand what happens behind the scene once an ambulance service provider has received a call. In addition, do Kenyans really understand the laws and regulations that have been set in place regarding EMS services?
This is Top Hill Hospital. How may I help you? Okay, right on our way.
My name's Edgar. My name is Edgar Aiga Chagema. Top Hill ambulance driver. I've worked with Top Hill for about 9 months now. We've got a call from ZK Prisons that there's a patient there. The person who received the phone call was our chief nurse, Nurse Etiang. We've used about 1 minute to take off from the hospital. And I think about the next 3 minutes we'll be there, where the patient is.
To be an emergency driver, one needs a set of skills.
Special skills that an ambulance driver is supposed to have. You should know how to navigate your way through to where you are going, how to maneuver in town. Yeah. And you should have the experience of driving for more than five and above years. Yeah. I have a special driving license with an EMT certificate. There are some crooked drivers who don't even know what an ambulance is. They do whatever they want to do. They are not following the rules. You find sometimes you have a patient in the car, in the vehicle. You've put your siren on, nobody wants to move, no one wants to give you way. You see, those are the kind of challenges I do regularly get. When no one wants to move. People don't even want to know what's happening behind them. They just listen to your siren like music playing on their ears. What I was telling you about the challenges I usually get. I had my siren on, lights on, there was someone driving in front of me. So when I was trying to overtake him, he didn't want to give way. He acted like he wanted a race. And eventually he ended up hitting me on the back, the vehicle's back. He was claiming I was the one on fault, so he wanted us to pay him. But eventually he decided to let go, and the case ended like that.
On location, patient could not be found, and he wasn't picking his call. However, after 3 attempts, he picked his phone, and the emergency workers were able to rush to his aid.
Okay, now we go.
Tuacheko hata ya uji hapa sisi tunakuanga hapa.
Wana turudi kwanza, funga mlango.
Maje dedi, simngoje tu hata ya uji. Ya dedi, sisi tunakuanga hapa.
At any other point you hear an ambulance siren, kindly just give way. Cause okay, at times you could not give way and end up causing more damage than saving more lives. So to anyone who's using the road, you hear the ambulance siren, kindly just pave way. Another road user does not pave way. Maybe you're carrying passengers who are 14 in number. Then this is an ambulance just carrying one patient and maybe 2 nurses plus an ambulance driver. You might end up losing the 4 lives plus the 14 lives, the other 14 lives. So okay, if a law should be passed so that it could help curb down the damage that could end up causing. Every morning we check our ambulance, we check the emergency drugs, we check whether we have the ambu-bags and examination gloves, sterile surgical gloves. We prepare early enough, that is every other morning we check. Whatever that is almost out of stock, we refill. Then in case there's an emergency that needs any extra thing to be added, we ensure before we leave the facility, we put it in place so that by the time we move to go get the patient, we don't find ourselves stranded just because maybe there's one thing we are missing or another.
And on arrival,
We have 3 nurses on standby in the casualty department. So when the ambulance is on their way coming, we are alerted about the patient. We are told about the condition of the patient, what really happened to the patient to cause the emergency. So when the patient is on his way, we are actually ready with the right equipment and the right tools to receive a particular patient depending on the emergency that the patient presents with. So when the patient arrives, we go in with the 3 nurses together with the doctor. First, the nurse in charge inside the ambulance will give me the information about the patient. If the patient is stable at that particular moment when they are bringing him. By stable, I mean, is the patient, there is enough oxygen inside getting to the patient, and is the patient stabilized in case there's a patient got a fracture in a certain area, so is the patient stable at that particular moment.
The vitals. So the BP is okay, saturations are okay.
The BP is 125/57.
Yeah.
Now, what was the GCS that day?
The GCS was 15 because he was oriented.
15?
Yeah, it was 15. He was just presenting with difficulty in breathing.
Breathing?
Yeah.
Currently the GCS is 15, the chest is okay.
Yeah.
It's clear. So let's just observe. So we'll take samples. We see and we see. Then we can do a chest X-ray. So as I receive the information from the chief nurse in the ambulance, the other nurses assist me in securing the vital equipment that are around the patient. So at that particular moment, it usually takes 2 to 3 minutes to get a brief history of what the patient had. So at that particular moment, we do something we call an ABC protocol, whereby I check the airway of the patient, if it was not secure at that particular moment, and how much saturation the patient is getting. By saturation, I mean the amount of oxygen perfusing into the patient's blood. As I check the air, I check the breathing of the patient. Is the patient breathing at that particular moment? And I check the circulation. So by checking the pulses of the patient, are they all present? Most of the pulse in the radial pulse, the cervical pulse, and the femoral pulse. I also check for the GCS. Now the GCS of the patient is mentation of the patient. How alert is the patient? Is the patient unconscious or is the patient alert? And in the GCS scale, we usually do grade it out of 15. If the GCS, we check the eye movement, response to eye, the patient's verbal response and the patient's motor response to stimuli. So if the GCS is less than 8, that patient qualifies for ICU management. So when the patient is stable at that particular moment and the airway is secure, we rush that patient to ICU, and more so for ventilatory support and any other care that they'll need. Now when the patient's GCS is between above 8 to 10, that patient will require high definition unit, a HDU, just to monitor. We are most worried about the respiration of the patient because we need the patient to be breathing. And if the GCS is above 11, so 11 to 14, that's a fairly stable patient. So what we do from there, we want to check any other causes that have brought the patient to hospital. So for example, if the patient has got let's say it's an RTA, a road traffic accident, and comes to you fairly conscious, that means the GCS is above 11, ranging from 11 to 15. So you want to check any other issue that can be life-threatening the patient apart from his loss of consciousness. So what we do, we want to check his abdomen, because that's where, if there's any bleeding inside the abdomen, that becomes very dangerous. So the patient is rushed in for imaging, a quick ultrasound of the abdomen to check for any bleeding inside the abdomen. We want to check the chest. So any fractures on the chest or any compromise to the lung will compromise the patient's breathing. So you want to check the chest, you want to check the abdomen, and the other major thing we check is the pelvis. So the pelvis, there are very many vessels passing through the pelvis. So if there's injury to the pelvis, the patient can easily deteriorate. The patient will have come with a very good GCS, but now when you miss the pelvic injury, the patient can deteriorate very fast. So you want to take for a quick imaging. You do your chest X-ray, you do your abdominal ultrasound, you do your pelvic X-ray. And then we do a routine head CT scan, even though the patient might have been conscious at that particular moment, because sometimes they lose consciousness as time goes by. So as we've reviewed that, and we found that if they are normal in any particular case, now at that particular moment you want to just check for any other causes of injury. Is there any other fracture anywhere else, let's say for this patient that has had an accident, or is there any other issue that has brought the patient? And when the patient is stable enough and you've managed your emergency care, you just take them to the ward for recuperation and medical management.
Before the ambulance gets to where the patients are, say it's a road accident, most of the time it's the people around there that help these individuals. How best can they help them? Because most of them are in critical condition.
Now, it will usually depend on the kind of accident that is there, how many people are involved in that accident. So you want to be careful and keen to those patients that are actually silent, you see, because those are the ones that either their consciousness has decreased, so they have lost consciousness. So we want to stabilize those patients first. And what I'll urge a bystander to do, a quick thing to do, you can just open the mouth of the patient, just slightly, look at what you can see, if there are any stones, and just remove what you can see to try help the patient breathe. Then you stabilize the patient. By stabilizing, I mean also stabilize the neck. Don't move the patient around. Make sure that the neck is stable. So if you have anything with you, if you can get 2 pieces of small woods that can actually stabilize the neck with, you don't want to move that because the patient might have acquired a C-spine injury and you might worsen it completely. You want to stabilize that patient. If there's any bleeding coming from any area in the body, more so the limbs, talking about the limbs, what you can see, bleeding from the limbs, either the legs or the hands, you want to try and tie off the bleeder. So whatever you can see coming out, whatever you have, something clean, a piece of shirt, anything, just rarua and tie it up. stop the bleeding at that particular moment. Before the ambulance arrives, the bleeding, if the bleeding continues for a very long time, the patient gets worse.
We've had a skit in the morning, and actually we were going to pick a patient at Eldoret prisons, a patient who had presented with difficulties in breathing. So he made a phone call to us. I received it, and actually he reported that suddenly he was unable to breathe. So we prepared within around 2-3 minutes. We had all we required in the ambulance, and we moved. By around 5 minutes, we are at Eldoret prisons. So trying to locate the patient was a bit tricky. Actually, we talked to him, then upon reaching him again, he could not pick his phone. So we had just to look at him around. By good luck, he picked his phone. Then we talked to him and we located him. We reached to the patient, we checked the vital signs because he presented with difficulty in breathing. So we had to check the oxygen saturation levels, of which were okay. So we moved him to the stretcher. Then upon moving him to the stretcher, we were helped by some public members who ended up asking us for some money.
Tuacheko hata ya uji hapa sisi tunakuanga hapa.
Wana turudi kwanza, funga mlango.
Maji dedi, simngoje tu hata ya dedi, sisi tunakuanga hapa.
So I'd like to urge the public in emergency situations, just help out of a willing heart. You don't have to be given something for you to lend a helping hand. Yeah, then okay, on our way back, even by the time we were going, we experienced some challenges by other road users. Actually, they were not paving way for the ambulance. So we had just to maneuver through just that way. Okay, normally, an ambulance should be respected. Especially you hear that ambulance siren, kindly just pave way. Because, okay, it is not always a joke in the ambulance. It is an emergency that needs urgent attention. So you find, like, for the road users, I would like to advise the other road users. Could it be pedestrians? Could it be those motorbike drivers, taxi drivers, truck drivers? Kindly just pave way for the ambulance, because we'd rather save that one life than lose more lives. Yeah. So that was the main challenge, apart from the inability to locate the patient. By the time we got the patient, one of us called the hospital to prepare to receive the patient in the next 5 minutes. So by the time we reached the facility, we already had 3 nurses plus a doctor, plus 2 doctors who are there ready to receive the patient. So they received the patient, we brought him to casualty, we checked the vital signs, they did the basic assessments of the airway, breathing, circulation, disability, and the environment. Then after doing that basic assessment, actually, okay, they requested for basic lab works, and after that, okay, they also requested for some basic investigations, which by the end of the day, okay, helped our patient, and our patient is right now stable. My advice to the public is that you should have these emergency contacts. It could be for a government facility, private facility, so that by the end of the day, in case of an emergency, you don't end up stranded. You don't start looking for that contact that time. You should have them, even you stick them in the walls of the house, anywhere else, so that even a kid, for example, a parent has collapsed, a kid can just pick it and you educate them. You tell them that, okay, this is an emergency contact. In case of any emergency, kindly just dial this number. They can dial, even if it is, okay, an ambulance they are calling, instead of maybe the fire brigade, it would help. Yeah.
As we wind up, do you have an emergency contact line? Or has this episode prompted you to get one? Join me next week as we discuss more health issues. I have been your host, Karen Cheriot.